With no end in sight to the COVID-19 pandemic, the World Health Organization is concerned the impact it will have on the achievement of the Sustainable Development Goals. The global health body says the targets are now on a steeper hill.
Talking about the direct impact of the COVID-19 pandemic and all of the indirect effects of this obviously impacts all of us beyond the SARS-CoV-2 virus itself. It impacts all of our ability to deal with other issues that our countries, our people have to deal with. HIV/AIDS that you mentioned, teenage pregnancy, being able to go to school. And I think, what we have been trying to do is to look at how can we tackle the pandemic? How can we bring transmission under control, drive transmission down to a low level so that we not only provide adequate care for those individuals with COVID-19, but that we can get these other services back online. We do know that individuals with HIV/AIDS have a higher risk of developing severe disease. We know people with other types of underlying medical conditions have an increased risk of developing severe disease due to infection with the SARS-CoV-2 virus. But we also know that people with underlying conditions need care for those conditions. Other medical services has been severely impacted because of the shutdowns, the lockdowns, inability to treat those other conditions. That is improving over time. There have been some advances with different things like telemedicine, but we are slowly starting to see countries bring these other essential services back online.
Countries should not lose hope.
We were already falling behind on SDG 3, the goal related to health, and the COVID pandemic has amplified, accelerated the challenges to being able to reach those collective goals around the world regarding health. HIV, TB and malaria have been three of the most important, and it is to be noted that access to prevention services and testing services for HIV fell significantly, and that has a major impact down the line in terms of people contracting HIV or getting into early therapeutic services. But at the same time, the number of people actually accessing antiretroviral therapy increased, which is a testament to the HIV treatment programs that they've managed to keep going and accelerate their impact. Equally, in tuberculosis, we've seen an increase in the number of people presenting with multi-resistant, or the number of people accessing treatment for multi-resistant tuberculosis has fallen. That's not necessarily because the rates have fallen, but again, it's an access issue. Malaria, I think, has been more stable, and with the movement and increasingly moving malaria diagnosis and treatment into the community with community health workers and an improvement in primary health care, we've seen the resilience of primary healthcare oriented services which have managed to continue within communities, while at the same time we've seen huge challenges to tertiary healthcare provision as COVID overwhelmed the health system. So we would absolutely agree with you that COVID has had a negative, notwithstanding the presence of underlying conditions that worsen the outcome for individuals who get COVID. Services for these very prevention services, diagnostic services and treatment services for these hugely important other diseases have come under severe pressure, and they are struggling and they need to be protected and rebuilt. But it's also a testament to the thousands of health workers around the world who have kept those services going despite the challenges. So it's both a sign of hope that we can increase our support to communities through community-led, primary healthcare-led services, but it also shows just how fragile those services are.
9 months after the first COVID-19 vaccine recipient in the United Kingdom, developing countries are still procuring for their populations.
Some of the countries with the highest burdens of HIV, the highest burdens of TB, some of the lowest immunization rates in the world, they also have the lowest access to COVID vaccines. And this just comes back to the theme the Director General is hammering today, is that we have got to get sufficient vaccine into the low-income countries if we are going to get the health system safe, protect the healthcare workers, so that we can get movement. All of these issues are interrelated, and they hinge on equitable access to scarce products and making sure the people who really need them, the people who deliver the services you're talking about, actually get them. And you'll remember the Director General announced the 40% target and 10% targets back in May, And since May, the high-income countries, you heard in his speech, there's been fantastic progress. The low-income countries, when the Director General made his call, had about less than 1% coverage. Today, they're at 1.4, 1.5, 1.7% coverage. I mean, it's just absolutely abhorrent what's happened, and this gap is what needs to be tackled, not just for COVID, but also for the delivery of other services, to run health services safe, and to protect the people that are out there at highest risk and who are at the cold face of this, the healthcare workers.
Sophie Mokoena, SABC News, Johannesburg.